A single mosquito bite may seem harmless, but inside your body, it can trigger one of the deadliest battles known to medicine. Within minutes, tiny parasites invade your liver. Days later, they burst into your bloodstream, destroying red blood cells, causing high fever, severe chills, anemia, and in some cases, damaging the brain, kidneys, and lungs. But what exactly happens inside your body? Why does malaria cause fever in cycles? And why is Plasmodium falciparum so dangerous? In today's video, we'll follow the malaria parasite on its incredible journey. From the moment an infected mosquito bites you to the life-threatening complications of severe malaria. By the end of this video, you'll understand exactly how malaria develops and why early treatment can save lives. Let's begin. Malaria is a parasitic disease caused by Plasmodium parasites and transmitted through the bite of an infected female Anopheles mosquito. 5 species commonly infect humans. Plasmodium falciparum, the most dangerous, Plasmodium vivax, Plasmodium ovale, Plasmodium malariae, and Plasmodium knowlesi. Although the disease begins with a tiny mosquito bite, it quickly becomes a complex battle involving the liver, red blood cells, the immune system, and multiple organs. Let's follow the parasite's journey step by step. When an infected female Anopheles mosquito bites a person, it injects saliva to prevent blood clotting. Along with the saliva, it releases sporozoites, the infective stage of the malaria parasite. Within minutes, these sporozoites enter the bloodstream and travel rapidly to the liver. At this early stage, the infected person usually feels perfectly healthy because the parasites have not yet begun destroying red blood cells. Inside the liver, the sporozoites invade liver cells called hepatocytes. Here, they multiply rapidly. One sporozoite can produce thousands of merozoites. Eventually, the infected liver cells rupture, releasing these merozoites into the bloodstream. In Plasmodium vivax and Plasmodium ovale, some parasites remain dormant as hypnozoites, which can reactivate months or even years later, causing malaria to return. Now the real disease begins. The merozoites invade red blood cells and begin feeding on hemoglobin, the protein responsible for carrying oxygen. Inside each red blood cell, the parasite develops through several stages: the ring stage, the trophozoite stage, and the schizont stage. As the parasites multiply, the infected red blood cell eventually bursts, releasing more merozoites into the bloodstream. These newly released parasites quickly invade fresh red blood cells, repeating the cycle over and over again. Each time infected red blood cells rupture, they release parasite proteins and waste products into the bloodstream. The immune system immediately responds by releasing inflammatory chemicals known as cytokines, including tumor necrosis factor alpha, interleukin-1, and interleukin-6. These chemicals reset the body's temperature control center, producing the classic malaria attack: sudden chills, high fever, and heavy sweating. Because red blood cells rupture at regular intervals, the fever often occurs in repeating cycles. As malaria progresses, more and more red blood cells are destroyed. Anemia develops because infected red blood cells rupture. The spleen removes infected cells, many healthy red blood cells are also destroyed, and the bone marrow temporarily slows the production of new red blood cells. As oxygen delivery decreases, patients become tired, weak, dizzy, pale, and short of breath. The spleen acts as the body's blood filter. It removes infected and damaged red blood cells from circulation. Because of the increased workload, the spleen enlarges, a condition known as splenomegaly. Some patients experience pain or fullness in the upper left side of the abdomen. The most dangerous malaria parasite is Plasmodium falciparum. Unlike other species, infected red blood cells develop sticky proteins that cause them to attach to the walls of small blood vessels. This process, called sequestration, blocks blood flow and reduces oxygen delivery to vital organs. In the brain, blocked blood vessels can cause cerebral malaria, leading to confusion, seizures, coma, or death. In the kidneys, reduced blood flow can result in acute kidney injury. In the lungs, fluid may accumulate, making breathing difficult. In the liver, patients can develop jaundice due to increased destruction of red blood cells and liver dysfunction. Malaria parasites consume glucose for energy. At the same time, the body's energy needs increase during infection. Some anti-malarial medicines can also increase insulin release. Together, these factors may cause hypoglycemia, leading to sweating, confusion, weakness, seizures, and loss of consciousness. The immune system fights malaria in several ways. White blood cells attack infected cells. Antibodies help neutralize parasites. The spleen removes infected red blood cells from circulation. People living in malaria-endemic regions may gradually develop partial immunity, reducing the severity of future infections, although it does not provide complete protection. Malaria is far more than a simple mosquito-borne illness. It is a complex disease that begins in the liver, spreads through the bloodstream, destroys red blood cells, and can damage multiple organs if left untreated. Understanding its pathophysiology helps explain why malaria causes fever, anemia, and life-threatening complications, and why early diagnosis and prompt treatment are essential. If you found this video helpful, don't forget to like, subscribe, and share it with your family and friends. This is William's Health Tips. Be empowered to resist.